So I set up Let's Talk Menopause because even with a healthcare background as a nurse, when I wanted some information, I found that the disparity of information out there and also the lack of information was quite alarming. So I just wanted to set up Let's Talk Menopause to raise awareness, whether that's within the community or whether that's within the workplace, because it crosses over a lot of different issues as a health issue. You've got your physical aspects, you've got your psychological aspects, your emotional aspects. So it does play a large role within the workplace as a health issue. So what I'm going to do this morning to cope with menopause within the workplace, whether you're regardless of whether you're HR, you're a manager or regular staff, you need to understand the menopause and what it's all about to be able to cope with it. And if you are in HR management, then you need to be able to understand all the different things to do with menopause so that you can then support your staff. So I'm going to give you a whistle-stop tour of the menopause and also tell you how to cope with it within the workplace. So to start off with, I always start off with a few quotes. The menopause, we're not aging, we're ripening to perfection. So that one, I love that one from the Indian Menopause Society. The menopause, there's this misconception, isn't there, that the menopause is associated with little grey-haired grannies tottering around the place, where it couldn't be further than the truth. You know, menopause, symptoms can start to evolve within early to mid-40s. A lot of the time women don't associate those symptoms with the menopause because a lot of the time women don't want to actually think that they're at that stage of their lives. Because they associate it with the aging process and getting older. So menopause essentially is just part of the female hormonal journey through life, and education start an awful lot earlier in life in schools to educate people about the changes that can take place so that people can cope with it a little more adequately. So every woman should have a menopause MOT at the age of 50. Well, there aren't enough staff within the NHS to facilitate that, so you have to be able to give yourself a menopause MOT. So after the information today, hopefully you'll go away, women here, and hopefully feel more empowered to be able to cope with menopausal symptoms. So I'm going to run through a few basics. You get a crick neck looking up at the screen, don't you? Every woman goes through the menopause. That's obviously a basic. You will know some of these basics. Around 80% of women experience symptoms. So there's 20% of women who sail through their lives not experiencing any symptoms at all. So they sail through with their libido and their pelvic floor completely intact and wonder what all the fuss is about. And that is half the problem because it's such a complex topic. We all experience differing amounts of symptoms, differing degrees of symptoms, and if you don't experience any symptoms, you can't possibly understand how debilitating some of those symptoms are if you've got a multitude of symptoms. It's easier to understand the symptoms by splitting them up into 3 different categories. So you've got your physical symptoms, you've got your psychological, emotional symptoms, and then you've got your genitourinary symptoms, so that's anything to do with the vaginal symptoms and the urinary symptoms. So the average age is 51. Again, that's a bit of a movable feast, but that is the average age of menopause. If you're classed as being prematurely menopausal, that's 45 years and under, and if you're going through a late menopause, then you're 56 years and over. Okay, so the menopause, it is the end of menstruation. But again, that can be a really touchy topic for some women. Some women like me will be hanging out the flags and cracking open the Prosecco because they don't have periods anymore. Whereas other women feel a form of bereavement because they're not within that reproductive phase within their lives. So it is this transitional phase from your reproductive stage to your non-reproductive stage. All symptoms are caused by fluctuating hormones, the main culprit being estrogen. So estrogen declining, you've got a bit of progesterone and testosterone in there, but the main factor is the estrogen declining. You've got different types of menopause. So you can go into menopause naturally, or you can be thrown into quite an intense menopause through surgery, even if your ovaries have been retained. So if you've had a hysterectomy, you've had your uterus taken out, they try and retain ovaries now to minimise the effects of going into an early menopause, but you still will feel experience some menopausal symptoms. And then if you had an iatrogenic menopause, that's if you've had chemotherapy, radiotherapy, so your ovaries become damaged. So then again, you can be thrown into quite an intense menopause. And that can be quite hard to cope with. So you've not just got your post-operative problems to cope with, you've also got menopausal symptoms to cope with. And dependent upon the postcode that you live in is dependent on whether how well that is explained to you pre-operatively as well. So what can affect the symptoms? Well, your lifestyle choices, your diet, your exercise, your race and culture. The Asian continent, they experience lower reported rates of menopausal symptoms. They've got lower reported rates of cardiovascular problems, of osteoporosis. So they're linking that back to lifestyle choices, diet and exercise. And usually by the end of a talk, people are glazing over because I mention lifestyle choices a lot. It really links in with all the wellness as well. So it's incredibly important when it comes to menopause. So alcohol, smoking and drug abuse, these obviously affect any health issue, and family genetics, family history and genetics. Well, if your mum's had an early menopause, it can follow that you experience an early menopause, but it doesn't always follow. Okay, so terms associated with menopause. I'm sure you're all aware of all these terms. Premenopausal, you're in that reproductive phase. Postmenopausal, if you've gone through the menopause. You can only be classed as menopausal if you've had 12 continual months of no bleeding, so you're actually only menopausal for 1 day, and then you go into postmenopausal years. If you're perimenopausal, you're in that period of time where you have, it's the most symptomatic stage. And there's a myth around this stage. That's why I wanted to put this slide up, because a lot of women will think they've got to get through that perimenopausal stage when they're experiencing all these symptoms before they can then go and ask for treatment. But no, you're experiencing all the symptoms, all your hormones are fluctuating all over the place, and that's when you need to go and ask for treatment if you think you need to get treatment. But we'll go into that a little bit later. Okay, so do remember that everybody's an individual. We're all going to experience symptoms in very different ways to differing degrees, but also that each symptom could be something, some other medical issue, so something like underactive thyroid, things like that, that can mirror some of the symptoms that you experience in menopause. So we've all felt a little bit like that. I always think when you're talking about anything to do with any health issue, you need to incorporate a little bit of humour in there. Definitely women have all felt a bit like that on the right, which is why I wrote my book. Okay, so how does menopause affect you within the workplace? Well, women can spend, we're not designed to live this long. You know, back in the 1900s, we used to live, life expectancy was about 59. We used to menopause later at 57. So our bodies aren't designed to live this long. So it's harder to actually cope with. So, but also we spend approximately 30% of our lives post-menopausal, and a period of that time is still within the workplace, obviously, especially with the spending longer time in the workplace. So we're an ageing workforce. We've got 47% of the UK workforce is female. If you take something like the NHS, you've got about 73-75% is female, if not more than that. 26% currently over the age of 50. Again, I think that's a much higher percentage. In reality, you've got difficulties coping with previously manageable workload, but then that also might be your perception as to how you're coping. So it's a bit like the swan analogy. You know, externally you appear to be coping exactly as you always used to do by your colleagues, but so you're all serene on the outside and you're paddling away furiously underneath. So it's your perception of how you're coping. And a lot of the time, as mentioned before, with any mental health issue as well, you know, there's a crossover there with menopause. There's this huge stigma still attached to the menopause within the workplace, which is ridiculous. It affects a huge amount of half the population. But a lot of women, they won't even feel comfortable going and talking to their GPs about their menopausal symptoms. A fraction of the population will actually think it warrants going to see their GP to get help. But then if that's the case, then obviously they're not going to go and want to go talk to their manager about their problems to do with the menopause. So providing an open conversation about the menopause is key, definitely within the workplace, but starting a conversation, raising awareness, providing information like this, but providing information not just for staff, but for HR managers as well. Have you got a sort of variety of staff here, or are you all managers and HR? Are you? You can talk to me, it's okay. Are you a multitude of different? Yes, from all sorts of friends. Right, okay, well that's great. Because a lot of the time I do go into the workplace and managers will provide information for the staff and then they're not getting educated themselves. So how on earth can they make those reasonable adjustments if they don't understand what it's all about? So symptoms can cause huge embarrassment, things like hot flushes. A lot of people titter away and go, oh, she's having a hot flush again, get the fan on for her. But that person actually might be, feeling really embarrassed by having those hot flushes. She doesn't want to have to make light of it all the time. They can be extremely debilitating. They're very distracting. And they're also, it's not very nice to have a hot flush if you have a really bad hot flush. You know, hot flushes can be a warm glow, or you can literally look like you've come off a squash court, and you can be dripping with sweat within 2 or 3 minutes. So if you need to wear uniforms and things like that, you know, things like making the reasonable adjustments, providing enough uniforms for people to wear, a change of uniforms for people to wear, providing access so that they can change their uniforms within a day, things like that is really, really important. So you know, symptoms can affect your ability to do your job effectively, obviously, and it can necessitate maybe changes within the workplace for that person. So they might find, because they don't feel that they can do their job effectively and they're not getting the support at work, that they then will take a different role, maybe a lower paid role, maybe a part-time role, and they will then unfortunately take time off work. They might not admit why they're taking that time off work, because they're embarrassed to, and then unfortunately some people then do take early retirement because of the menopause, which is a shame. So how can management help? Well, acknowledge the menopause as this long-term health condition. It's not a lifelong condition, it's a long-term health condition. Provide the education, as I said, for everybody. Make sure that management is educated, but also appoint a key figure within management who is informed, who is approachable, who you know that staff will feel able and readily able to go and talk to. Within the workplace, it's really, really important to provide education for male staff as well as female staff. In other organisations, I've to facilitate this, you know, lots of the time I'll go into organisations and obviously it's predominantly females that will turn up. That's for a few reasons. Some men don't feel comfortable turning up about an issue which is a female health issue. They also feel sensitive to the fact that some women wouldn't feel comfortable them being there, so that if there's, you know, time for discussions afterwards, they wouldn't feel comfortable maybe having question and answers afterwards, so it might inhibit some women from coming forward. But also it's providing that education freely for men. So in certain organisations, what we've done is provide male-only sessions, and these have worked really well. They've been really interactive. I thought, you know, when we started them, they might be a little dry, and mine might just sit there and take it all in, write notes and go away, but sometimes you can't shut them up at all. Just the questions are flowing, which is great, because a lot of the time they've got perimenopausal partners or wives at home, perimenopausal colleagues at work, they're sandwiched between the two, they don't really know where to go, and at the end of the day they want information as well. So provide a behavioural guide for management, also provide that accessible menopause policy, and it's brilliant. You've got a menopause policy now, which is fantastic. It's essential that people have something to refer to, but make provision for support and care through your occupational health. But also that occupational health, they have to be informed as well, otherwise they're just going to refer them back to the GP, and that can sometimes not be that successful. So make the reasonable adjustments as well. So make the practical changes. Usually these do not incur much cost. It's using basic common sense. So it's providing desk fans for people. It's making sure that if people in a desk job, that they are near ventilation, so maybe they're near the windows. It's amazing the different stories that I hear within offices of people who just won't move seats for somebody who's suffering from hot flushes. It's a very small thing to do. Provide sanitary products, free sanitary products within bathrooms. That can be just such a small thing to do, but usually offices are not near Boots or anywhere like that, or a pharmacy to go and get sanitary products. Just providing simple sanitary products can make a big difference. But then thinking about uniforms, providing lots of uniforms for people who have to wear uniforms, but make sure they're made from natural fibres, can make a big difference as well. You know, within the NHS, what lots of nurses are doing, they're ordering oversized uniforms because they're made from synthetic fabrics. Very cumbersome, not very pleasant to work with. So it's using a bit of common sense sometimes, and it doesn't have to cost a lot. So getting back to the actual menopause diagnosis, this is an important slide, because a lot of women, I think, you know, it takes a long time to actually get a GP appointment, doesn't it? And then you've got 7 to 10 minutes to actually get across how you're feeling. Usually burst into tears, tell them you've got hot flushes, and then you forget exactly what you've had, the other things that you've gone to talk about. So you want to come away with something concrete from that appointment, and That's because there's been far too many FSH tests, so that's the follicle stimulating hormone test done. You should only have a blood test done, a hormone test done, if you're prematurely menopausal, and that's because your hormones are fluctuating so much, the test is virtually inaccurate. So you could be having that test one day and then 2 or 3 days later you have the same test, you'll get a completely different reading. So really don't go and ask for a blood test, please, unless you are prematurely menopausal. And if you are prematurely menopausal, you need 2 blood tests done. They need to be 4 to 6 weeks apart. They need to be done at the right time of your cycle, so they need to be done around the 3rd day of your cycle to make that test as accurate as possible. So an awful lot of time the tests aren't being done accurately. So diagnosis should be able from talking to your GP or your healthcare professional by describing your symptoms, so from symptoms alone. And just remember, it can also be difficult to diagnose menopause if you're already on hormone treatment. So if you're on contraceptive treatment, you've got hormones going in there, that might actually be masking some of your symptoms. So just be aware of that. I've got contraception there with an exclamation mark, because if your golden rule is if you're 51 and under, then make sure that you cover contraception for 2 more years. If you're 51 and over, make sure you cover contraception for 1 more year. Obviously, fertility rates are dropping massively at this time, but people do get through the net. So unless you want to hear the pitter-patter of tiny feet, then do make sure contraception is covered. So we'll get on to symptoms. You all got a handout, and if you haven't got a handout, then there's some more here that can be passed around. So basically there are over 34 different symptoms that are associated with the menopause. The physical symptoms, the most common ones that we all know about, the vasomotor symptoms, so the hot flushes and night sweats. They can be accompanied by palpitations. So if your palpitations aren't cyclical or not accompanying those hot flushes and night sweats, and you're worried about them, then obviously go and get those checked out to check it's nothing to do with any cardiovascular problem you might be having. So these are the most common symptoms and problems with the bleeding. That's most common symptoms, and some of the first symptoms that start to appear. So the ways to cope with these symptoms, I think a lot of the time, because of the limited amount of time that your GP has, this 7 to 10 minute appointment, they don't have time to get across to women all the different options that are available to treat these symptoms, and that can be really important as well. So again, within the workplace, it's good to be able to provide information, accessible information to women on how, and good resources onto how women could go about helping their own symptoms themselves. So there's lots of things you can do naturally to help to cope with these symptoms. You're not going to cure these symptoms. Nothing will completely cure these symptoms. There is no magic pill, unfortunately. But there are different ways that you can help reduce the intensity, and you can reduce the frequency of these symptoms. So the first way is by looking at lifestyle choices. What you eat, what you drink, and how much you exercise and how much you hydrate plays an enormous role in coping with these symptoms. So what you have to do as well is to find out the triggers for your hot flushes and night sweats. They can be completely random, but they can be triggered by certain things. So they can be triggered by certain drinks. Your classic ones are caffeine and alcohol. So always the good things in life. So and also foods, things like spicy foods can trigger, or just going into a hot environment, just going into a warm room like this could trigger hot flushes for some people. So first of all, what you want to do if you're experiencing lots of hot flushes and night sweats, make sure you keep a hot flush diary for a week. Sounds really nerdy, doesn't it? But find the precursor to those hot flushes and night sweats occurring. Make sure you find your personal triggers, and then either cut them down or take them out of your diet and your lifestyle. The other ways of coping with hot flushes and night sweats is to try and engage with some form of cognitive behavioural therapy. Does anybody practice that here? Or positive mindfulness? So we're hearing, yeah, that can be really positive. So cognitive behavioural therapy, there's an enormous amount of research going on at the moment. There's a really good book with from several organisations. I would highly recommend getting this book into your organisations, making it accessible for people to have a look at if you do form a menopause hub, for instance. It's called Managing Your Hot Flushes and Night Sweats by Professor Myra Hunter and Dr. Melanie Smith. I'll pass it around, so if you want to take a photograph of the outside, you can do. It's basically a self-help guide to teaching yourself simple CBT tools, and these tools are not only useful for coping with hot flushes and night sweats, but then they can be transferable to other problems, things like your psychological problems, mental health, things like this, they can be transferable and can really help. So things like diaphragmatic breathing. Does anybody do yoga here? No? Not very communicative lot, I tell you. So with diaphragmatic breathing, what you're doing is you're doing belly breathing. So essentially, when you're taking in a breath, instead of when we're stressed and we're anxious, what we're doing is we're breathing, your chest is going up and down, and the more anxious you become, the shallower your breaths become and your chest goes up and down. Okay, if you want to breathe calmly and you want to calm yourself down, you want to try and turn your brain off from having that hot flush and night sweat, and also turn yourself off from thinking about having that hot flush and night sweat, what you want to do is try and focus on diaphragmatic breathing. So by doing diaphragmatic breathing, when you take a breath in, you effectively blow your tummy out. So if you imagine watching a baby in a cot, their breathing is very calm and slow, isn't it? And their tummy's going up and down. So you're increasing the amount of oxygen going into your body. But what you're doing is you're switching your brain off from having that hot flush and night sweat, and you're also switching yourself off from getting anxious about it. So I think we should all try one here. I'm very much about interactive talk. So if you put your fingertips over your tummy, when you take a breath in, what you're wanting to do is you're wanting to separate those fingertips. So when you're breathing in, you're blowing your tummy out, and then you're breathing out. And your outward breath is just as important. Then if you're breathing in and out. So immediately you slow that breath down, don't you? But you're actually thinking about what you're doing. So best thing to do to advise anybody who's experiencing a lot of these things, send them off, go and get that book, and then you start learning some simple CBT tools. But by learning those tools, if you're feeling anxious or stressed, they're going to increase the frequency of your hot flushes and night sweats. So all these tools then transfer onto all the emotional, psychological symptoms as well. So problems with bleeding, these can be really debilitating in the workplace for women. Lots of the time you get this 20% of women and they sail through it, their periods sort of fizzle out and they get spacing in between periods and then they just completely stop, and again they're wondering what all the fuss is about. With the other extreme is you can develop really heavy bleeding, and it's amazing the amount of women who do not go to their GPs with these heavy periods, because there are certain things that can be done to help with these things, and it's making people aware that they should go and seek medical attention if they're experiencing any problems with any form of bleeding, vaginal bleeding. It's really, really important that people do go and see their healthcare professional. So problems with bleeding, you could have non-hormonal treatment prescribed, tranexamic acid, or you could go down the hormonal route of having maybe a Mirena coil fitted that has the dual role of covering contraception as well. Or there's a small surgical procedure if you've finished having your family, because obviously that reduces your fertility. You could have an endometrial ablation. So having all these different options explained to people is really important. But this is when you need a blood test done to check your iron levels, because obviously if you've got low iron levels and if you're slightly anemic, then you will be experiencing fatigue. You've got experience that contributes to insomnia, to joint pains, things like that. You might need a little iron, which then will help you cope a little better with everything as well. So fatigue, definitely if you've got some of these above symptoms, you'll be experiencing fatigue. But joint pains, anybody associate menopause with joint pains? No, well, you've got estrogen receptors all over your body, not just around your ovaries. So it's just all over your body. So estrogen plays a huge role in bone mineral density and also with the lubrication around your joints. So a lot of women will say, oh, I thought I was just getting arthritis. Well, you can get a blood test to check you've not got rheumatoid arthritis. You can exclude that quite easily. But a lot of the time, you know, it will be part of the problem. With any of these symptoms, there are different contributory factors. It's not just solely down to estrogen deficiency. But definitely estrogen plays a huge role with bone mineral density, and the lubrication around your joints can become more glue-like. So you need to try and release that glue-like substance. So you have to do the opposite what a lot of women want to do. A lot of women will just want to sit with their feet up at night, and the opposite is correct. You need to be doing different forms of exercise, lots of exercise and a variety of exercise. You don't have to go and run a marathon. You can do small amounts of exercise, things like cycling, swimming, Pilates, yoga, all these sorts of things. As long as you're moving those joints, it is really beneficial. Make sure you've got a really healthy diet. You've got lots of calcium, vitamin D. It's the only time I'd definitely advocate having a supplement is a vitamin D supplement, but make sure you have it as a single supplement, not a multivit, so you know exactly how much you're having. Okay, we'll move on to fine motor skills. So again, anybody is a typist here, you feel that your fingers are, I was speaking to a load of touch typists the other day, and their targets had greatly reduced around the time of the menopause because they just couldn't get their fingers to work as fast. So again, can affect all sorts of things. So knowing that that can be a contributive factor just can provide a little bit of a relief to somebody who's a touch typist and can make them think a little bit more positively about things. But if you are experiencing fine motor skills, just simple things like putting your hands in hot water can make a huge amount of difference throughout the day. Simple things make a big difference. You don't have to immediately seek medication. So insomnia, this is a big problem with the perimenopause because estrogen definitely plays, declining levels of estrogen definitely play a role in contributing to insomnia, but there's lots of different contributory factors, aren't there? You know, work relationships at home, what you eat, what you drink, how much you exercise definitely contribute to insomnia. I was doing a men only talk the other day, and the majority of the men there were saying, well, I suffer from insomnia as well. So it can be just part of this time of the lives that we experience more insomnia. So there's two types of insomnia you experience. Either you can't get to sleep, or you can get to sleep and then you wake up at exactly the same time every morning. Anybody get that? Mine used to be about 4:38 every single morning. I used to think, why is it always 4:38 every morning? But your body's in this 24-hour circadian rhythm, so you have to break that rhythm. So first of all, you may have to make sure that you've got a good sleep hygiene. So that means your bedroom is just for sleep and for sex only. It's not an extension of your office. So no tech devices within that bedroom, no phones, no televisions on, no laptops on. You know, probably loads of people take their phones and their laptops to bed. Make sure that the ideal is with anybody with real insomnia, if you shut down all your LED screens at least an hour before you go to bed is a must, because it definitely contributes to eye strain and insomnia. So make sure you just make simple tweaks to your diet, your exercise, but also your bedtime routine. If you don't normally have a bath before you go to bed, have a relaxing bath, something like that, instead of just tumbling into bed. But you have to change that 24-hour circadian rhythm. So the best route with any sleep experts, their advice at the moment is if you've been lying in bed for about half an hour, don't lie in bed anymore and get anxious and stressed about the fact that you can't get to sleep. All you want to do is remove yourself from the bedroom. So your head, subconsciously, you associate that bedroom with sleep, sex and rest, and you're not associating it with anxiety. So make sure that you make an area within your house, close to your bedroom, say dimly lit, something with either some music or a book to read, somewhere where you can go with a dim light on and just take yourself out after 30 minutes, go there for about 15 or 20 minutes and then go back into the bedroom, and do that 2 or 3 times a night. And gradually, over the course of a few weeks, by doing that repeatedly, you will start to change that rhythm. Okay, so moving on, because I've got a bit of a whistle-stop tour this. So weight gain and bloating, again, estrogen contributes to an awful lot of things, and it will contribute to slowing your metabolic rate down and how your digestive tract works. So certain foods that you could always eat, you sometimes might not be able to eat them because they will result in you having bloating and things like that. For me, it was wheat. And again, it's a matter of keeping a food diary, seeing what the precursors are for something like bloating, using a little common sense. If it is causing bloating, then obviously take it out of your diet or reduce it. But again, with bloating, with weight gain, you don't have to make dramatic changes. Making slow, sustainable choices definitely is the best way to go. And looking at your lifestyle choices, looking at your exercise levels, looking at your diet, hugely important, but we'll go through that later. So the psychological symptoms / emotional symptoms, these are some of the hardest ones to cope with. We've just heard about the mental health issues as well, and CME, so all crossing over. Never underestimate the link between these symptoms and your physical symptoms. If you can tackle these symptoms, you will cope an awful lot better with your physical symptoms. And these symptoms, I think, these will start to rear their ugly heads maybe within the early to mid-40s. And a lot of the time people won't actually associate these symptoms with the menopause. They don't have time to think about these symptoms until they get too bad. We're not known for the sandwich generation for nothing. We've got maybe teenage children on one side that we're coping with. We've got elderly parents on the other, and we're sort of sandwiched between the two, trying trying to work as well, and we just think we're getting anxious for other reasons, that we're getting too distracted by either too many pressures which are causing poor memory and things like that. But no, these are incredibly common. And when I put this slide up in workshops, it doesn't matter if I've got 20 or 150 people in front of me, there's usually a huge sigh of relief that they are very common. And the more people talk about these symptoms, as with any form of mental health, the better people will cope with them. And the more that they are normalised, then the better people will cope with them. Anxiety and stress, really common. Poor concentration, low mood swings. Low mood swings are really different to full-blown clinical depression. And a lot of the time there's been historic over-prescribing of antidepressants for the menopause, because you've got that 7 to 10 minutes in a doctor's surgery. It's a very quick way of getting a lady out of your surgery if they say they've got hot flushes and low mood swings, because it does help to treat those symptoms, but it should not be the first protocol. It's now down within the NICE guidelines of 2015 that this should not be the first line of treatment for low mood swings. But antidepressants do have their place within the medical world, so it also shouldn't be forgotten about as well. But anything to do with any of these symptoms, you have to look at your diet, you have to look at what you're eating, you have to look at how much you're exercising, how well hydrated you are, and do look at things like cognitive behavioural therapy tools, definitely positive mindfulness. If you heard about the apps like Headspace and Calm, yeah, heard about those sort of apps. Plugging yourself in when you're at work, just for 3 or 5 minutes into Headspace, having that bit of light relief, giving yourself a little bit of time to yourself, can be enormously beneficial. Panic attacks, they're not so common, but definitely sometimes anxiety can graduate into those as well. So do be aware of these within the workplace. So we've all felt a little bit like that as well. And the important slide there is, so I prefer to call it Puberty Part 2. The earlier you educate people about the symptoms of menopause, the better, and the better that they're going to cope with them later in life. So really, I am definitely behind education within schools, not just about the menopause, but about the whole hormonal female journey. Because at the end of the day, we all know about puberty, don't we? We all know about pre and postnatal problems and pre and postnatal care, and yet we don't know anything about the menopause, which is absolutely bonkers, because it is just about hormones. If you think about some of the symptoms that maybe if you've got teenage girls, that they're experiencing irritability, low mood swings, problems with the menstrual cycles, they mirror symptoms that are happening within menopause because it's to do with the fluctuating hormones. Yeah, makes sense, doesn't it? So educating from as early age as possible. So if you do get some talks within your various organisations, make sure that you encourage the younger population to come along, so then they know, they're forewarned what might be happening to them later in life. They might not experience any of these symptoms, but it's better to know about them, and then they'll have more empathy for older work colleagues as well. And if you're in management, definitely it helps. So the genitourinary symptoms, these are symptoms which nobody really likes to talk about, that really lots of women will not go to see their GP about, because a lot of the time they don't think that there can be anything done. Well, I like talking about vaginas because nobody else does, and this is one of these symptoms that they are so easy to treat. But again, within the work, think, what on earth is the relevance within the workplace? Well, they're part of the menopausal symptoms, and these can really affect women, and they're very debilitating. And if you've got some of the urinary problems, if you've, they can be, the first off, they can be really painful. Secondly, they're very debilitating because they, you need to have to go to the loo 10 times more than normal. And if you just educated people on how to cope with these symptoms, some of these symptoms can be easily rectified. So they're very common. Vaginal atrophy, what does that mean? Well, it means that the estrogen declining is making the tissue around the vulva and the vaginal area thinner and less elastic. So that might result in vaginal irritation, dryness, soreness. It also affects the acidity of the vagina, so that means that your pH levels are changing, so you might become more prone to infections, things like that. So again, within the workplace, women might have to take more time off work. They're not going to tell the main manager why they've got to go and have that GP appointment, are they? They're going to say they've got some other reason. And that's obviously, if you're a male manager, these symptoms are obviously a little bit trickier to talk about. So urinary problems, frequency, urgency, leakage. You imagine how close your vagina and urethra are. Obviously, estrogen receptors everywhere. It's going to affect those symptoms. It's not going to be the whole cause of those symptoms, but it definitely does contribute to those symptoms. So the main problem with urinary problems is definitely having too many stimulants, like things like caffeine and alcohol within your diet, but also the main problem is people's pelvic floor. So how many women and men, we all have a pelvic floor. How many of you do a pelvic floor every day, pelvic floor exercise every day? Yep. Do you one every day? Men as well? No. Every single person in this room should be doing a pelvic floor exercise every day. And I definitely recommend every single person in this room to download an NHS app called Squeezy. It will cost you £2.99, and it is one of the best apps you'll download because it will tell you how to do a pelvic floor exercise. It will give you timed exercises. It will give you reminders to do those exercises, because a lot of the time we fully intend to do the pelvic floor exercise, don't we, and then we forget. But it's an NHS app. It was devised by physiotherapists that specialise in this area within women's health, but also it's relevant for men as well. So I won't make you do one. I usually make you do one, but we're a little bit short of time. So if we get time at the end, we'll do one. But do look at that app. Recommend it for everybody to download. It will definitely help. But going back to educating from as early age as possible. If you educated within schools the importance of doing a pelvic floor exercise, then women will be in a lot better state prenatally and postnatally, and then going into the menopause. There's uproar on Twitter at the moment to do with the advert about the tenor pads. Has anybody seen that on ITV? Yep. So you've got this late 20s, early 30s woman she's standing next to a cot with a baby in, and she's basically pulling on a nappy, and that is not the norm for anybody postnatally. It's a muscle, is the pelvic floor, and it just needs exercise. It's attached by ligaments, so it needs a little bit more exercising than you think, because you've got to help those ligaments as well. But you definitely can change having the effects of having frequency, urgency and leakage. It is a muscle, it just needs exercise. And the problem, I think, with quite a lot of these symptoms, things like your vagina, obviously it's not on view, you don't see it. Hardly anybody goes and has a peek at it. You definitely could go and have a peek at your vagina and definitely see what is normal for you. But the same goes for your bones and for your arteries as well. So things that you don't see, you tend to not really tend to worry about or do anything about until there is a problem further down the line. So this is why it's really, really important to think about your lifestyle choices. Think about what you're eating and think about what you're drinking and how much you exercise, because it all links and has a knock-on effect. So reduced sex drives, loss of libido. Obviously there's lots of different contributory factors. How long have you been married within that relationship? But also estrogen does play a role in reducing loss of libido. But if you look at your lifestyle choices, the more you exercise, definitely, if you have a better toned pelvic floor, you will experience better orgasms. That is a fact. Intercourse can be painful and uncomfortable because of the dryness. Again, think about things like vaginal moisturising lubricants. These are really, really normal and very, very frequently used. It's not just for sexual intercourse, it's for rehydrating, for remoisturising. But if you do have a problem in this area, then the best form of treatment is to have vaginal estrogen prescribed. This is a tiny, tiny, tiny amount of estrogen. It's localised treatment, so it's going exactly where it's needed. You can either have it in pessary form, in cream form, or there is a ring which is impregnated with estrogen that gets inserted, and that stays in for 3 months and can be replaced after 3 months. It is extremely normal to have that prescribed, and also you can have it in conjunction with systemic HRT, but we'll go on to that in a little while. I'm sure I've made you sweat over that slide for a little bit too long, so we'll go, I'm going backwards. There we'll go, rare symptoms, there we go. So, hang on a minute, that's not right. Sorry, we've got the slides mixed up, there we go. So, rare symptoms. There are some rare symptoms, things like dry skin. Again, look at your diet and your exercise levels, your hydration particularly. Burning mouth syndrome, that can feel like the roof, if you've had some really strongly flavoured crisps and the roof of your mouth feels like it's been scraped off. Some women have experienced mouth ulcers, but that's due to all down to your imbalance of hormones. So dental problems, I don't mean that your teeth are going to fall out or you're going to get bleeding gums. That's a very different matter. But you might get more sensitive teeth and more sensitive gums. Thinning hair, this is very common, usually postmenopausal. But again, you can start to get redistribution of hair, can't you? You can start getting hair in places that you don't want it, maybe on your chin. There's a lady whizzed into Tesco's car park next to me the other day, whipped out her tweezers and started plucking her chin instead of her eyebrows. But that sort of thing, you know, is really common. It's very, very common. So you just have to go with the flow and know your body. Formication, not fornication. This feels like insects crawling on your skin. It's really annoying, really, really annoying. And restless leg syndrome, anybody get that? Really annoying lying there at night. So you've got your insomnia, you've got your restless leg syndrome, you've got really hot, itchy legs. Not very pleasant. The best thing for that is to get up and move around a little bit, or to cool down the area as well. So potential long-term effects of estrogen deficiency. Well, remember, everybody is very, very different. We're not all going to develop osteoporosis. I'm sure the media would love us to think that. And we're not all going to develop cardiovascular problems. But the more you look at lifestyle choices from an early age as possible, you know, we'd reach peak bone mineral density between the ages of 25 to 30. So making sure you have a really good diet is really important. Making sure you have lots of calcium and vitamin D in there, really, really important. And also your exercise levels, but making sure that you do a variety of exercise. So you've got your weight bearing exercise, your resistance exercise, things like Pilates and yoga really play a huge role, because they not only help with your core, but they help with balance. So they're helping to prevent those osteoporotic fractures as well. But also osteoporosis, it's a silent disease, and the first time you'll know that you've got it sometimes for some women is that, you know, they'll just trip and they'll develop a fracture, unfortunately. So it is a genetic disease. So if somebody within your family, so immediate family, so your mother's side has got osteoporosis, then do go and get referred for a DEXA scan, and that'll tell you what your bone mineral density is. But again, osteoporosis links in with those urinary problems as well, because a lot of women, the older they get, you know, if they're getting up because of frequency and urgency during the night, that's the time when they trip and they have that osteoporotic fracture. So making sure that you really look at all the different symptoms is really important. Estrogen plays a role as a protective role for the cardiovascular system. But again, if you've got a really good lifestyle, then you can help prevent any cardiovascular problems from developing. So ways to manage your symptoms, well, you can do that naturally through your lifestyle choices that I've been going on about. You've got your hormone replacement therapy, you've got non-hormonal treatment, medical treatments, but usually you'll find that the non-hormonal medical treatments, things like clonidine, gabapentin, the antidepressants, they will treat just one or two different symptoms, whereas HRT treats a whole umbrella of different symptoms. You've got alternative remedies like herbs and supplements, we'll go into those as well, and then you've got alternative therapies, things like CBT, Pilates, things like that. So lifestyle choices, definitely excessive alcohol and caffeine, anybody knows these affect any health issues. So do think about reducing caffeine levels. You know, everybody metabolizes caffeine at a very different rate. Some people, the effects of it stay in their bodies for 5 hours. Some people it's 12 hours. So it depends how your metabolic rate individually works. So do think about cutting back on that. And alcohol as well, we're not meant to have more than 2 to 3 units a day, not all the 14 in one or at the weekend, definitely. And it will affect how you cope with those symptoms and how they exacerbate themselves. Smoking obviously affects any health issue, but it can pop you into an early menopause, and can also inhibits absorption of certain things, nutrients, and the way that you absorb medication as well. So it is definitely a time to choose to live a better, healthier lifestyle. And I think a lot of the time women will say to me, oh my God, it's just this stage of life you don't want to think about. Well, you know, you have to think about it a little bit more positively and think, right, okay, I'm just going to get my lifestyle choices under wraps here. So I know you're all extremely healthy, have extremely healthy diets and lots of exercise in your life, but just a few basics. Definitely count the nutrients, not the calories. We are in a society obsessed with counting calories, unfortunately. Make sure you've got your unrefined foods going in there, reducing the caffeine and alcohol. But avoid fatty diets, because you've got to maintain the balanced nutrition. And with fasting, there's huge movement of people who really think fasting is a good idea. But if you think about your body. Your body needs energy throughout the day to function. So if you're fasting, it's not getting any of the energy. So if you're desperate to do a fast, do a natural fast. So by that I mean have your balanced nutritional diet up to the time of about 5:30, 6 o'clock. Then don't have anything to eat until 7 o'clock the next morning, and that includes milky drinks. And then you've had a natural fast throughout the night when your body doesn't need as much energy. Makes sense, doesn't it? So with exercise, make sure you set yourself realistic goals. So, you know, I've got loads of friends of mine who really hate the sight of Lycra. They don't like gyms. They don't like conventional exercise. You know, 10 minutes of high intensity exercise is equivalent to 30 minutes of aerobic exercise. So it's a matter of finding something that suits you, isn't it? And a lot of people will say to me, well, I work full time, I've got children, I don't have time to do exercise, but everybody can set their alarm 10 minutes earlier to pop in a bit of exercise. It just takes a bit of organising. So we'll get on to HRT. Everybody wants to know about HRT. And again, within the workplace, as manager, it's really, really important to get accurate information across on things like HRT to people. Sometimes going to see their GPs can be a huge hurdle for some people. They can't actually get an appointment, and then they'll try lots of supplements. They'll spend an enormous amount of money on supplements and alternative remedies, and they don't, because they're scared of even going and talking about HRT because of the media coverage. Well, first and foremost, I would say don't read any newspaper about any health issue. If you want to read about HRT, go and read the websites which are written by the clinicians who work within the field of menopause day in, day out, who've done the actual research. So that's the British Menopause Society and the Women's Health Concern. So the Women's Health Concern is the patient arm of the British Menopause Society, and they've got fantastic fact sheets on anything to do with menopause. You've got resources on the back of those sheets, and they've got resources on HRT, and they're kept up to date, but they're accurate and evidence-based. So HRT benefits definitely outweigh the risks. It definitely helps to relieve the short-term symptoms, and by replacing that estrogen, it is helping to it's helping to prevent the long-term symptoms. So important point there, the quote is from the British Menopause Society: there's no arbitrary limits for duration of treatment. So as long as you are, it always used to be that people weren't allowed to be on HRT for more than 5 years, wasn't it? So it's golden 5 years, don't know where 5 years came from. But as long as you're under the care of a healthcare professional and you are regularly reviewed annually, there are no arbitrary limits as to the limits of that duration of treatment. So, as I said, it relieves and controls menopausal symptoms. It helps to relieve those long-term symptoms and reduce the prospects of developing osteoporotic fractures. It helps to improve muscle mass and strength, and it has that potential cardioprotective effect. But it also has additional benefits of reducing the risk of colorectal cancer, type 2 diabetes and Alzheimer's as well. And it's interesting actually, when I give talks, people who are worried about a certain aspect will key into one word. So one woman came up to me after a talk. She said, "Do you saying that I'm going to develop Alzheimer's?" I said, "No, I didn't say that. It can help to reduce the risk of maybe potentially developing Alzheimer's, but all our bodies work in very different ways to each other's, and it depends on how your body is working as to what you develop. But if you are prematurely menopausal, it is really, really important that somebody, if there's no contraindications as to why the person should not be on HRT, that they are encouraged to take HRT, because then that helps to prevent all of these healthy issues from developing. So there's different routes of administration. So the HRT is composed of estrogen and progesterone. So if you've still got your oestrus, then you need estrogen because and you need your progesterone rather to protect your endometrial lining. So if you've had a hysterectomy, you don't have your uterus, then you don't need that progesterone component. So the progesterone is only there to protect the endometrial lining. So you could have it orally in tablet form. That's the most cost-effective way. You could have it transdermally through the skin, through via gels and patches. That's the safest way. That's the safest delivery system because it's not pre-processed through your body. It's not being processed through your liver. It's slightly more expensive, and there are problems with production at the moment of patches and delivery of those, but that is improving apparently. So you've got your intrauterine devices like the Mirena coil that releases progesterone, And then you've got your vaginal estrogen as well. But there are over 50 different combinations of HRT. So your prescription is only as good as your prescriber. So you need to find somebody who really knows what they're talking about. And if your GP is not engaged, and there's some fantastic GPs out there, but if they're not interested in female health, and they're not really understanding your symptoms and they're not engaging with you at all, then you could go onto the British Menopause Society website, punch in your postcode, and that'll tell you where your nearest menopause specialist is. They are few and far between, but your nearest one here is Chalmers Street in Edinburgh, and you will get a very good prescription from them. So it's a matter of looking at your symptoms as to what best suits you. So you could have a combined oral tablet, or you could have a combined transdermal patch, or you could separate them. You could have an estrogen patch, and then you could have your progesterone in the form of Mirena. So if you've got heavy periods, you could have your Mirena for your heavy periods, and then you can have your estrogen patch. The good thing about splitting these the two components up is that it makes it easier to alter the level of that estrogen. So you could start off on a low level patch and then increase that accordingly, or likewise, if you're wanting to think about coming off HRT, then you can reduce that more easily. Orally, or you could have an estrogen patch, and then if you've got problems with insomnia, you could have your progesterone at night time in tablet form, because that helps has a drowsy effect as well. Then also you can have your systemic HRT in combination with your vaginal estrogen as well, if you've got particular problems in this area. Okay. So risks associated with HRT, well, the main risk that everybody worries about is breast cancer. The important point to make here is that your risk returns to baseline if you stop HRT. So that suggests that the HRT is acting as a promoter, not an initiator. So it might be accelerating those cancerous cells. And also it is down to the duration of time you're on and the type of HRT they're on. So when all the studies came out, there was all that media hoo-ha, they were using a very, very old-fashioned type of form of HRT, and there's much more sophisticated combinations now. HRT, which is called, I won't go into huge detail, HRT called body identical, which is so that the estrogen and the progesterone are more like your own estrogen and progesterone. These are very, very different to bioidentical hormones. So bioidentical hormones you need to stay away from. So these are made from compounded foundases. They haven't had the full research and clinical tests that the body identical ones have had. So stay away from bioidentical hormones. And never buy your hormones on the internet, please. I do hear about certain people who are saying, oh, well, I just bought some progesterone cream off the internet. Well, the progesterone cream does not provide your uterus with enough protective effect for the endometrial lining. Okay, so don't go and buy hormones off the internet. So DVTs, so deep venous thrombosis and pulmonary embolism, your greatest risk, as with any hormone treatment, so like contraceptive treatment as well, is within the 12 months. But in comparison, if you think about the risks of developing breast cancer, it's hugely more risky to be obese or overweight, or if you have more than two or three units of alcohol a day, it's definitely more risky. There is a sheet, I'll hand this round because it's a really good visual thing which you can download off the Women's Health Concern. It's a good visual guide. I don't know if you can see it though. So you've got 23 extra cases of breast cancer diagnosed in a year. So you've got an additional 4 cases there in the red, if you can see that, of anybody on combined HRT. I won't go through this enormously, but then down at the bottom there, you've got an extra 23 cases if you're overweight or obese. So it really puts it into perspective, doesn't it, why lots of healthcare professionals now will be banging on about your lifestyle choices first and foremost, okay? And then you've got about 6 or 7 fewer cases there if you're having more than 2.5 hours of exercise a week. So it's a really good visual guide to look at. Anybody can download it and pop it up in your organisations. It's a really useful one to look at. So we'll quickly move on to herbs and supplements. Yep, they do have their place. You won't get any healthcare professional recommending these because they don't have the clinical trials. They're very much treated as food supplements. Very little scientific evidence, but they do have their role, definitely. And some women, you know, they will find something like black cohosh or sage, which can help with hot flushes. If you don't have too severe symptoms, then sometimes they can work. What I would advise you to do if you want to go down this route, because they're quite costly, some of these things, aren't they? Especially the supplements. It costs about £20 and £5 to £20 a pack. And when you go and try 5 or 6 different types and then don't use them all, it does become quite costly. Whereas I would spend your money more wisely and go and get an appointment with a medical herbalist or phytotherapist, definitely, because they will know, they're going to give you an hour's appointment, but they're going to know what herbs will interact with other herbs and other supplements, and then also with other medication that you might be on. So the main point to consider with these is remember that they will also have side effects and they will interact with other medications that you are on. So the golden rule is if you're on HRT, then don't stay on all your herbs and your supplements. And if you're taking herbs, make sure these herbs that you're taking aren't interacting with each other, and don't then go and have supplements as well, because they will be interacting as well and causing side effects. So everything has a side effect that you're putting into your body. Just because it's a herb, it's a natural substance, doesn't mean to say it's going to have a side effect. Okay, if you are just buying off the shelf, then do look for the THR logo, traditional herbal registration logo. That means that it's been approved by the powers that be within the herb industry, because there are a huge amount. It's a big business is this, and there's lots of different supplements and herbs out there. Do look at the back of the packets, because there's lots of packers and fillers in these things, and maybe not quite as much as the herb as you would like. Okay, so alternative therapies. All these are really beneficial, but mainly because they're non-invasive, aren't they? And they are. You can go and access them yourselves. You don't, you can go and access classes, but they're really good for a natural way of coping with any of your symptoms. So things like cognitive behavioural therapy, positive mindfulness, thinking about headspace, thinking about calm apps, things like that. Definitely advocate doing any of those. Yoga and Pilates, Tai Chi, try and incorporate at least one class into your week. Definitely. Acupuncture, things like hypnotherapy. Women have said these have helped them, definitely. Massage, that should be on the NHS. Aromatherapy oils, popping in a bit of geranium oil into your bath, that's good at rebalancing hormones. That can have a really beneficial effect. Any sort of talking therapy like counselling can really help, but just having some form of rest and relaxation within your week can help to reduce the intensity and frequency of your symptoms. Popping a magnet down your pants, starting the magnetic therapy. This is a magnet that sticks to either side of your pants. Well, there's no evidence that this works, but there no clinical evidence anyway, but there's lots of women who have whipped out the magnets in front of me and say, well, it's a miracle cure for me. So that is absolutely fine. It's non-invasive. It will trigger the alarms going through an airport, and it will pull your shopping trolley key towards you, but it's not, it's quite a strong magnet. But if it's having that placebo effect, then that's fine. So in summary, provide the accessible information. That's really important. Make sure you're confident about talking the menopause. Maybe call it something different. There's a huge stigma attached to the actual the word. Just talk about the hormonal journey or female health issues, something like that. Term it in a different way. Provide support for all your staff and managers. Make sure male and female staff are both included in that, and make those simple, reasonable adjustments. But also, if you're providing that information, you are helping to motivate people to self-manage their menopause. So just to close, we've got some useful signposting. It's always useful to signpost to websites that are accurate evidence-based. So the first one is Women's Health Concerns. So that's the patient arm of the British Menopause Society. You've got Menopause Matters. That was founded and is run by Dr. Heather Curry, who's still a practicing gynecologist and obstetrician, and she's past chair of the British Menopause Society. So she really knows what she's talking about. You've got the BMS there. Again, if you've got GPs who really don't know what they're talking about, you're a little at a loss, then direct them to the British Menopause Society. Tell them to scroll along the top to publications, down for tools for clinicians, and they can download really good summaries on anything to do with the menopause, and that's updated regularly. My website doesn't replicate any of the information above there. There's absolutely no point. They're very adequate. So mine's just a chatty blog. It's just a little bit more easy to read format of certain symptoms. And then please do download that Squeezy app. It's really good. You've got the Daisy Network. That's an excellent resource for anybody who's prematurely menopausal and anybody who's got one of the 5 gynae cancers. The Eve Appeal is really good for EVE, for anybody, as a really good resource for that. So 2 books, definitely try and pop a copy of that Managing Hot Flushes and Night Sweats into your organisation. And then I did write a book, Men Let's Talk Menopause, because a lot of time I predominantly do talks for women, and they'll always say, you know, my colleagues or my partners, I wish they could all hear this information. So it's a very slim book for a low attention span, so you could read it in an hour, but it's packed with information and it's very accurate and evidence-based. Okay, so me.